Genuine question. If you've had eczema your whole life and you agree with using steroids, how come it hasn't gone away / healed? My son has eczema. I'm looking at how best to help him, thanks. That's a very good question. So eczema is an inflammatory skin condition, and unfortunately there is no cure for it at this point, which means that we can treat it and we can overcome flares, but there is no way to completely get rid of your eczema ever. My eczema was really bad when I was a kid, and thankfully it has improved as I've gotten older, and that is very common. Now, as well as not having a cure for eczema, unfortunately we don't fully understand what the cause of eczema is. But we do know that various people will have triggers, and the triggers can range from having anything that can irritate the skin. So the type of clothing that you wear, the type of laundry detergent that you use, the type of perfumes or fragrances you might spray around you or around your house, they can all irritate the skin and trigger a flare of eczema. Now, for me personally, I've not needed steroids for several years now, but I use emollients all the time. And I have thick, greasy emollients, which are like 50% paraffin, and I've got thinner ones, which are 15% paraffin, which are less greasy, but better for use in the daytime. Now, I use these emollients as soap substitutes. I use them in between patients. I usually carry a little tub of them around with me so that if I feel that my hands are getting dry, I just use the emollient. And for me, that gives pretty good control. If I was going to suddenly enter a flare of eczema today, I'd contact my GP and ask for some topical steroids because they work, and when used correctly, not for prolonged periods of time, the risk of topical steroid withdrawal is actually quite low.